Hi everyone, welcome back to my YouTube channel. So in today's video, we shall be discussing how to write a sub note. So what is a sub note? So this is a method of documentation employed by healthcare providers writing out notes on patient's chart on progressive treatment. So before I proceed, I would like to explain or identify the letters representing subnote. So S represents for subjective, O represents for objective, A represents for assessment, and P for pram. So now we shall be discussing one by one how to write a sub note on a patient's chart. So let us proceed. So let us start for S. S represents for subjective. S represents for subjective. S representative for subjective. So in the subjective section, this is where you are going to report your patient's concern. For example, you are going to report what your client is saying or how they feel like. For example, you must identify the chief complaint of the patient. So you have to identify the chief complaint of the patient. Chief complaint. So you have to identify the chief complaint of the patient that is the major concern or the compelling problem that has brought the patient in the hospital or in the clinic. You must also identify history. You must also identify history of present illness. History of present illness and history of past illness. So in the chief complaint, you must also identify history of present illness. What is the patient complaining now? The major concern that the patient is in the hospital right now exactly. So when you are doing this, make sure you are supposed to give consideration on the onset of the patient's complaint. So the first one is onset. So you have to consider the onset of the patient's symptoms. So you have to consider the onset, that is the starting duration of the patient's symptoms. You must also consider any palliating factors, any palliating or provoking factors that may make worsen the symptoms of the patient. So you have to consider or identify any palliating or provoking factors that can make worsening about the symptoms of the patient. So you must also identify the quality of the patient's symptoms. So quality of the patient's symptoms. Quality. So you have to identify the quality of the patient's symptoms. For example, the importance. What is the fundamental of identifying the symptoms of the patient? So you must also identify the region affected by the body. So you have to identify the region is affected by the body of the patient's symptoms, or if there is any radiation to other parts of the body. So you have to identify the regions of the body that have been affected by the symptoms of the patients by doing physical examination. So you must also identify the severity of the patient's symptoms. So you have to identify the severity of the patient's symptoms, if the symptoms of the patient is worsening or not. So you have to identify. So you must also identify the cause. You must also identify the cause or the time of the patient's symptoms. So the time that the duration that the patient has been feeling these symptoms. So you have to identify. So in the subjective section, you must also identify past medical history. You must also identify past medical history or maybe surgical history So you have to identify past medical history or maybe surgical history. So you must also identify family history. Family history of the patients. Maybe if any other members of the family had the same condition that the patient is suffering now. You must also identify social history. social history. So this will give you detailed summary about the socio-economic activity of the patient, for example, the job or the income of the patient, maybe if there is any related factors, psychogenic stress related to economic crisis. So this way you're going to identify. Okay, let us go for the objective. Let us go for the objective. So O represent for objective, O represent for objective. So in the objective section, this is where you are going to gain factual information about what you observed from the patient. For example, measuring vital signs. So you start by measuring vital signs. Vital signs. So you start by measuring vital signs. For example, we have the PP, that's the blood pressure. We have the SpO2, we have the pulse rate, we have the respiratory rate, we have the temperature. So you have to identify and record vital signs of the veins. For example, blood pressure, oxygen saturation, pulse rate or heart rate, respiratory rate, and temperature. So you record the measurable data such as vital signs, and you go for the physical exam. Then you proceed in the physical exam. So whenever you are writing a subnote, make sure you start by the vital signs, then you proceed in the physical examination. For example, any assessment review of system is physical examination, starting from the head to the toe. For example, the head, the ears, the neck, throat, respiratory system, cardiovascular system, abdominal system, neurological exam. So this is how you are going to transit. Then you go for you identify the lab, you report the lab results. So in the lab results, you have to identify any laboratory examination. For example, CBC, that is complete blood count, CBC, that is complete blood count, or LFT. So LFT means liver function test. You must also identify any other relevant diagnosis by using imaging tests. For example, we have the X-ray, we also have CTS. So CTS means computer tomography scan. So we also have ultrasound. So ultrasound is scan. Lastly, you must also identify any other relevant diagnosis. For example, ECG, that is electrocardiogram. So in the objective section, this is what you are going to observe and record, like starting from the vital signs. Then you proceed in the physical examination, review of systems systematically. Then you go for the impression. Then you identify the lab results. For example, if there is any other relevant diagnosis, for example, complete blood count, liver function test, X-rays, computer tomography scan, ultrasound scan, and electrocardiogram. So in the objective section, this is what you are going to identify. So let us go for A representative for assessment. A representative for assessment. Assessment. So in the assessment, this is whereby you are going to combine the general information that you have obtained in the subjective and in the objective section. So you summarize your report, the information that you have gained in the subjective and in the objective section. For example, you provide a diagnosis. So you have to provide a diagnosis based on the subjective and objective data. You provide a possible diagnosis by summarizing your information obtaining in the subjective and objective data. So in the assessment, this way you summarize all the information that you have obtained in the subjective and objective. Okay, P standing for plan. So in the plan, this is whereby the next step you are going to take for you to treat the patient. So in the plan, you outline the treatment, you outline the treatment, including medications, procedures, and follow-up. procedures, and lastly follow-up care. Follow-up care. So in the plan, this is whereby you plan in the next step by treating the patient. So you outline the treatment, including medications, procedures, and follow-up care. So now we shall see an example of a SOAP note. Okay, let us now see an example of a SOAP note. An example of a SOAP note in the subjective, objective assessment and plan. So let us start in the subjective. Let us start in the subjective. So in the subjective, for example, we have patient reports. Patient reports a sharp pain. Patient reports a sharp pain. A sharp pain in the right lower abdomen. In the right lower abdomen. In the right lower abdomen for the past 24 hours. For the past 24 hours. For the past 24. For example, in the subjective, we have patient reports a sharp pain in the right lower abdomen for the past 24 hours. So this is an example of subjective. We also have objective. So in the objective, this is where you are going to observe the vital signs. For example, in the objective, we have temperature 98.6 degree Fahrenheit. So BB, we have BB 120 or all over 80 mmHg. Then tenderness in the right, tenderness in the right lower quadrant, tenderness in the right lower quadrant. For example, in the objective, we have temperature. These are the vital signs. That is 98.6 degree Fahrenheit. BB, blood pressure 120 all over 8 mmHg. Tenderness. So this is a tenderness observed in the right lower quadrant of the patient's body. Then in the assessment we have, so this is the possible diagnosis. For example, we have the suspected diagnosis. We have suspected diagnosis. Suspected diagnosis is appendicitis. Appendicitis. So in the assessment we have a suspected diagnosis that is appendicitis. Then last we have the plan. So what is our plan? Then refer to surgery. Refer to surgery for evaluation. Refer to surgery for evaluation. So initiate with IV fluid. Initiate with IV fluids and pain management. So in the plan we have refer to surgery for evaluation. Initiate, you start with IV fluids and for pain management. So this is an example of a SOAP note. So in the subjects we have patient reports a sharp pain in the right lower abdomen for the past 24 hours. Then in the objective we have temperature 98.6 degree Fahrenheit, BB 120 all over 8 mmHg, tenderness in the right lower quadrant. Then in the assessment we have suspected diagnosis appendicitis. Then in the plan we have refer to surgery for evaluation. Initiate, start with IV fluid and then for pain management. So this is an example of a SOAP note.